All right, good morning. It happens to be May 15th. Is today the 15th? 16th. Wow, time flies.
Actually, it's, the 16th, yes.
Okay, and this is Senate Health and Welfare. So our goal today is to finish up some work on a really important bill, H91. We received the bill 3 weeks after crossover, and we've really put it up on the top of our agenda and worked overtime to improve the bill as much as we can before sending it back to the House. Yesterday, we received a memo from the administration that they would like some very significant changes to the bill. There could be some changes that we might make based on that memo. I've actually sat down and asked Katie, Nolan, Katie to help us out with possible suggestions on that. So what we are going to do right now, and that will be something that we look at as a committee. This is not mine, this is ours. Remember that. So what we are going to do right now, we're going to take a break. And then when Katie has drafted up some language for us, I'll tell you what it is. We're going to ask the administration for recommendations that come back to us in November, and perhaps some things that could go and be discussed during the BAA process. The administration has some concerns about the bill. So we'll look at that language and then we'll make a decision about how to proceed. We can add it into the bill or not, and then I really would like to vote the bill out. It has a ways to go. It has to go to appropriations, and then it goes probably more than likely. It will be an interesting conference committee process. So it isn't finished when it leaves here by any means, but we want to make sure that all the work that we've done in here, working collaboratively with the administration and with all of the affected parties, we have worked very hard to come to some decisions that were agreeable. And it's difficult when you get something the last day. So we're trying to accommodate as much as we can. And we will look at language. So that's where we are. And Senator Cummings.
That email confirms to me what I've been worried about the whole time. That the administration just wants to pawn off the homeless, underfund it, and make it somebody else's problem and make it go away. It is not just difficult. We've been actively working on that bill for 3 weeks or more. The administration's people have been in this room to come out the day before the last day that this committee is in session is disrespectful in the extreme. And if that's what they're going to do, then I'm prepared to let them keep their problem. I mean, I hear you. It's
I hear you.
unbelievably disrespectful to this committee, to the legislature. It's like, I want you to do what I want you to do or else. And that's dangerous. It sounds like a Black Sharpie person.
Thank you for your comments. Well taken, well taken. And we'll look at what comes in here, Katie, and see if we can ameliorate any of their concerns, but we do not have time to do any more than that, period. We need to get this bill into conference. So I'm gonna ask us to take a break. Don't go far. I would say 15, 20 minutes. And it's not over yet because I did just meet with the commissioner, and he also had another suggestion beyond what I had just shared with you. And he's talking. Obviously, there's a lot of discussion going on outside of it, all the way up to 5th floor.